You're now tuned in with Tea Talk with Tenika. So today's podcast, we're going to focus on endoscopy. Now you're probably wondering what is an endoscopy, so we're going to get right into it. We're also going to cover a lot of other things about this procedure. We're going to cover about the cost, the cleaning, and everything. So just stay tuned. First, an endoscopy is a medical procedure that allows a doctor to see inside the body using a thin or flexible tube with the camera. Now, of course, you're curious on how is a camera going to go inside of a body. So, the camera goes through a natural opening in the body, like the mouth, the urethra, or the anus. And that's how the camera sees pretty much things that needs to be seen in a body. Now, why would a camera need to be inserted? It can look for things such as acid reflux or ulcers or Crohn's disease or any type of tumors, just anything that cannot be seen physically on the outside of the body. Now, after the procedure, of course, you're going to have to clean the instrument. So, we're going to get into the cleaning and how it's done. So, the first thing you're going to do is pre-clean it. So you're going to wipe down the insertion tube with a clean, soft cloth soaked in detergent. And then you want to flush the channels with water to remove any air or any type of visible dirt or debris that you may see. The next thing will be a manual cleaning. You want to make sure that you take everything apart and also flush all of the channels with a cleaning solution that can also remove any visual debris off of it. The next thing will be a high-level disinfection. What is that? So with this process, you want to make sure that you are following the manufacturer's instructions thoroughly. That is key. You want to always make sure that you are following any type of instructions, but mainly the manufacturer's instructions. After the high-level disinfection is done, you're going to go in and you're going to do a rinse and a drying. You want to make sure you are thoroughly rinsing everything because you're going to use cleaning solution. So whenever you rinse it, you want to make sure that all of the cleaning solution is getting rinsed off. You don't want to leave none on it at all. The next thing you're going to do is completely dry it. You got to make sure it's dry. And then there's other things that you want to think about. You want to think about what you should wear. And if you're curious on what you should wear your PPE, which is your gloves, your gown, your eye protection, and any other thing that you need. Maybe your shoe protectors, face shield, a mask, hair coverings, anything that keeps you from getting contaminated you want to put on. You also want to make sure with this instrument you're doing a leak test to see if you can find any malfunctions wrong with it, like a crack or a leak, anything, because it is really important that you are checking it to make sure it's not being used during on a patient, during surgery, or before surgery, because it can really put a patient and your job and everybody else around you at risk, and that's a huge no-no. And of course, you want to make sure that you are documenting everything. Documentation is key right along with cleaning. If it's not documented, then it's not going to be counted for. So if something was to go wrong or if something was to go missing and there's no documentation on it, it's like a lost cause, because how are you going to know if this item is actually cleaned, or how are you really going to know if this item was actually used or when it was used and what time it was used? So there's like a lot of things to think about during this process. So you may be wondering as well, where do you get this done at? An endoscopy, where can you get it done? So you can get it done at a doctor's office, an outpatient surgery center, or a hospital. Now we're going to get into the cost. Since I stay in South Carolina, I'm looking at the South Carolina cost of this procedure. So it states that the cost without insurance would be around $1,000 to $2,500 per surgery. And that may be considered a lot of money to some without insurance because times is hard, There's a lot of things that people cannot afford, and out of pocket costs for this procedure can really, turn a patient to like figure out like what is it that they need to do or how they're going to get it paid for because they don't have insurance. And not everybody is qualified for certain things when it comes to insurance. So there's a lot of things to think about when it's coming to a topic about insurance. Like who is qualified, how do you get qualified, how do you get the insurance to even pay for the surgery. There's a lot of things that you need to take into consideration, or you can take into consideration about it. So as we are coming to an end, wrapping up this podcast, we went over what is it, we went over the endoscopy, we went over the meaning, we went over how you clean it, we went over the cost. And my take on it, I kind of feel like everything is so fascinating to me. Like I'm so excited to even be able to learn more about everything. Like who would have thought of a camera being able to go inside a human body to see things? Like that is so amazing. Like I find so much interest in that, and I'm also excited to take everything that I have learned during the course, put it towards like my future to learn, because I am so excited to start my journey in the sterile processing department. There's so much more that I want to learn about surgical tools, because there's so many tools that I feel like we have not covered or was not covered, but I'm so excited to learn about all of the tools possible and what they're for. The whole journey is just going to be a big thing for me. Like I'm super excited, and all of my resources I pretty much got off of Google. And also just by like certain course material that I remembered off the top of my head, I also used that as well. So this is the end of my podcast, and I hope everyone enjoyed it.